Hey guys, Dr. Anita Haque-Parker here, and we are working on knee pain, patellar issues, femoral issues, patients who have a lot of aches and pains, especially as the weather cools down. You might get more patients complaining of knee pain. So just a couple of ways to help your patients further. I'm going to demonstrate on my patient, my model over here. First and foremost, I remember learning in chiropractic college to adjust the patellar joint like so. If you guys remember this type of technique and you don't like it, I'm going to show you a few more, so hang tight. If you're doing this technique, the goal is to get under the patellar cap here. I'm in a tissue traction with my thumb. I keep that tissue traction and I wrap my whole hand around the knee. Now I'm going to have the patient relax as much as they can, and my thrust is just by pushing the actual ankle towards the buttocks. Okay, that would be the thrust. Now I gotta tell you, over the last 17 years adjusting patients, this is not the only technique that I like. In fact, I found some other techniques that I find more comfortable for patients who may not like it. And since I'm a small female, my hands sometimes seem a little bit too small for a larger knee. Her knee is not so large, but if I have a larger patient, it might be uncomfortable. So here are some other ways that you can help your patients further with knee adjustments, okay? One is to traction the knee joint. So how I do that is I grab a hold of the leg, I place both of my hands at the back of her knee. In fact, they're kind of interlaced a little bit lightly, so that way she knows she's supported. Why interlace around the knees? Because my goal is to cavitate and traction the knee joint, okay? That's the goal here. So in order for me to do that, I'm gonna shake her leg a little bit. Go ahead, Sabina, relax the whole weight of your leg in my hands. And she knows she can relax because I've got full support. She's between my legs here, and she's also under my hands here, okay? So just let your whole, and once I feel like she's ready to relax and I can feel the give in the knee joint, all you do is move back. It's that simple. There we go, okay? And you might actually feel this release, and a lot of times patients feel their hip joint release, which is a good thing in most cases because they connect and they affect each other. Okay, so that's second way to do it. Third way to help your patients with the knee joint is, if you don't mind, go ahead and flip on over. My technique on this one is a drop table adjustment. So with my drop table, because it's like this is my lower drop, I might have her come up a little bit higher, so scooch up just a smidge. I get to the back and I'm going to palpate the back of the femur here on both sides to see what's lacking in motion. She's got a little bit, yep, definitely we can do some more work on this knee. So I'll get the drop table ready, make sure my resistance is correct for her so we don't hurt her, push too hard. And once I get that knee in the right spot, I make sure her ankle is also placed in the right spot. I like to use a thenar pad. It's more comfortable for patients usually to take on a fleshier contact. And then all I'm going to do is keeping her ankle kind of supported, just push down. Simple as that. You can also, of course, depending on how it's subluxated, you can place your hand at a different portion on the back of that femur, back of the knee joint, to adjust accordingly. Okay, so make sure you're helping your patients further with knee adjustments, and if you want more tips on how to adjust your patients' knees and lower extremities, make sure to join me for my next webinar by signing up below. We'll see you soon.